Coming up next on Fox 66 News, easing the pain. We'll tell you why partial knee replacements are a better alternative for younger patients.
This is Fox 66 News, first at 10.
More than 790,000 knee replacements are performed each year in the United States. For patients, it's one way to eliminate the severe pain and stiffness caused by injury or years of arthritis. But as Lou Baxter reports, doctors can now remove just a portion of the knee and still offer patients relief. It's a story with your health in mind.
Here, Brooke, go over there and I'll kick it to you.
Jonathan Stevens and his family have their hands full.
We live on a small farm in northern Indiana.
Kick her up!
Never had a farm before, so we're kind of figuring it out as we go.
But everything changed when Jonathan started feeling severe pain in his knee.
It was like someone had a hot ice pick and they were shoving it right into my knee, and it stayed there.
Couldn't straighten it all the way out.
Doctors told him he would need a knee replacement.
And unfortunately, you're too young. You're too young to have one.
Instead, doctors offered Jonathan another option.
Partial knee replacement is something that not everyone's exposed to. It's replacing just a portion of the knee.
Knees are made up of three main compartments: the medial, lateral, and the patellofemoral joint that hides behind the kneecap.
And all three of those can be replaced individually versus a total knee replaces all three at once.
So if pain is only coming from one of these areas, then a partial will replace only that area.
It's a lower risk and it's lower morbidity and a quicker recovery. 80% of patients who get a partial knee replacement never need another operation.
Yesterday, we had Brooklyn up on the horse and she wanted to go faster. But yesterday I was actually running with the horse and Brooklyn on. There's no way I could have done that a year ago.
Keeping us doing what we love. Lou Baxter, Fox 66 News.